Is that better? I pushed it too many times, I guess. All right, I'm just so eager, Jamie.
Hi, Jennifer. I didn't think you wanted me to talk today because you wouldn't turn your mic on. I couldn't hear you.
Oh, there we go.
So historically speaking, we've never done this before, but I felt it to be important to kind of bring you guys up to speed about our year-end 2022. And really important to me is kind of where we were over the past several years. So I'm just going to click through these slides really quick. Apparently there should be some information in front of you if you can't see the slides. But the first slide is our death reports and autopsies. Best practice in the forensic world will tell you a 5% autopsy rate is pretty standard for what we would expect out of a coroner's office and medical examiners association. So from 2016-17, we were at about a 10% rate. We finished out 2022 at a 5% autopsy rate, which is really good. Our deaths came down from 2021 to 2022 by about 300, which is pretty significant for our volume. So we finished with 3,395 death reports and completed 187 autopsies. And unless I'll just click through these, and then we can, if you guys have a question at the end, we can talk about that. Our autopsy cost is a pretty significant line item for us when we can considering how much it costs to pay a pathologist and our tox. Both of these expenses went up for 2022. The top line is our NMS lab, which is our toxicology agency that does our tox. That cost went up comparatively. The orange line is 2022, the blue line is 2021. If you're looking in black and white, I'm sorry. The bigger numbers on top, obviously. And then below that is the autopsy expense for the pathologist and then her assistant. Those numbers went up as well because we did more autopsies, you can tell. 187 in 2022 compared to 160 in 2021. So that cost went up significantly, but so did the rate of what we were paying for both of those items, the tox and the pathology assistant and the pathologist herself. Our accidental deaths went up significantly. And this might not seem like a lot to go from 30 to 49, but some of these accidental deaths might have required an autopsy services or toxicology services. So the fact that they went up might require a little bit more intervention on our behalf. So what are those accidental deaths? There's a quick grid for you. It's kind of sporadic, but it goes over the last 4 years. Our drug overdoses were high, then they went down, now they're a little bit back up. And I have another slide about those in a second. Falls continue to be our #1 cause of accidental deaths across the county, and those are generally for people who are 65 years or older, who have subsequent pathologies or pre-existing conditions. They fracture a long bone or a pelvic, and then they have complications that continue that lead to their demise. Motor vehicle collisions is a wavering number as well. They kind of go up and down. Pedestrian deaths. Surgical deaths, I always put in there because I think it's important for people who are going to have a procedure done to check who their providers are and what their outcomes are for their procedures, because they do happen. And our infant deaths is something that we focused on over the last few years with the Prevention Task Force. And that number has gone up and down despite our intervention of providing cribs for moms who otherwise wouldn't have had one. Motorcycle deaths are in there, and then choking and miscellaneous. A lot of people choke, believe it or not. I think an effort for 2023 and 2024 would be some efforts in CPR in saving people and providing that kind of BLS support for people who are choking, because it happens often. And then those are the totals, so you can see the increase. Our overdose deaths went up. 4 people isn't a lot, but those are 4 souls of parents who have children or siblings or someone in their family who has struggled with substance use disorder. That number went up because we're seeing a significant increase in the quantity of fentanyl in our drug screens. Typically, it would take about 1 to 3 nanograms per milliliter of fentanyl to take a life, and we're seeing fentanyl levels in the 20 to 30 range of nanograms per milliliter, which is almost Narcan resistant. So it takes perpetual amounts of Narcan to reverse those who are overdosing when there's fentanyl included in that. And we're also seeing and continue to see synthetic opioids like xylazine in the drug screens as well. So, and those are very, very difficult to reverse with Narcan. Our suicides only went up by 1 soul this year in 2022, which is good. And I kind of have that broken down by our mechanisms. We had 17 male and 5 female. And the number one mechanism is a gunshot. Second to a medication overdose, and then asphyxiation by hanging, and then one person is a fall from height. And I put the mechanisms up there not for any other sake of the purpose other than it's a data point. Our homicide rates are down significantly from 2021. They went from 34 to 28. I broke those out by zip code, and the 61605 continues to be the leader of our homicide data across the county. Second to that was 61604, and then 61603, where our office sits right now. And that's it. That's the data that I wanted to present for you. If anybody has any questions, I'm happy to answer them. One thing I will mention is we have had a turnover of employees over the last 3 to 4 months for various reasons. Most of our turnover is due to people leaving our office who love the job, but they have to seek better paying jobs and better health premiums, which is understandable. But it's a difficult feat for us to have to recruit. And to give you an idea what the recruitment's like, last year when we posted a job, I had 30 applicants. In February when we posted, we had 4. So it's a significant change from last year to this year for what we have to offer employees coming into our position, which can't be considered entry level because of the forensic work that we do. We have to have substantial people with healthcare backgrounds or some sort of forensic law enforcement background to do the job to the quality that needs to be done. So it's been a struggle, but we're moving forward with what we have, and we're building the best that we can. So.
Any questions for Jamie? Thank you for that presentation. Well, it was pretty cut and dry. Thank you. We'll move on to the ETSB. Thanks for waiting for us.
I don't really have anything new to report. We are back at the drawing board with the Stark County. And getting ready to go back out for bid again. Once our drawings come back, we have kind of had the same problem that the health department had due to cost.
It's on. I saw the green. It's on.
There we go. Sorry about that. So anyway, what I was saying is we're back at the drawing board with Stark County. Due to cost, our costs went up a lot, and so we will be going back out for bid soon once our drawings come back. So that's kind of where we are with that. Dispatch centers are running fine. Be happy to answer any questions anybody has.
Thank you for your report. Any questions? All right.
Thank you.
Again, I will encourage anyone who hasn't been to our dispatch centers to get out there and see how incredible they have everything planned in their operation. So,
Yep.
all right, thank you. Let's see, we'll move on to the monthly update for PCAPS.
I just have one point of information to add about the vet services, that we are on track for a July 1st start date for that program. If you'll recall, the board approved a contract with Dr. Brown and Brown Animal Hospital beginning July 1st. We currently have an RFP out for the PCAPS mobile unit, and the bid should come back for that on April 3rd. So we're excited for that project to happen.
We'll look forward to an update there. We'll hear more from Becky in a bit. Any questions, though, on this? Oh, yes, Nate.
Just a point of interest. I'm a cat lover by marriage. And it mentioned in your report about the number of cats that were, I believe it was, euthanized or passed away. Do you know what the counts are between those two?
I don't have that in front of me, but I could certainly get it for you and send it to you this afternoon.
Yeah, do you know if there's 2 that passed away and the rest of them were euthanized, or what the balance was? They're just for my interest. Thanks.
Absolutely. It's actually probably in about that vein, but I'll get that to you.
All right.
And thanks. Any other questions? All right, thank you. And our public defender report.
Thank you. Good afternoon. I will start off by apologizing to the committee for, let's see, last time I addressed you, I promised you this time I would have a written report. So I'm going to have to this time promise that next time I'll have a written report. I'm very sorry about that. As you all know, we're going through this period of transition since Nathan Bach was elevated to Judge Nathan Bach, and I am the interim public defender, as I explained last time, and at this point, I remain the interim public defender. I did not file a written report. Again, I apologize. However, I can give you an oral update of a couple of noteworthy things. The items that I have today would be the progress towards the completion of our new office, which is down on the ground level of the courthouse. It's moving along nicely. We did a walkthrough just on Friday, and I think last time I had reported that they were completed with the demolition part of it, so it was very cavernous. It was just a very, very big, large, empty space at that point with a lot of wires hanging down. Well, we walked through on Friday, and now there's a bunch of framework that's up. I suppose it's aluminum alloy type frames they put up, and they square off the offices, so you can physically walk through it and see exactly where the floor plan said was going to be an office, and lo and behold, there's a framework for the office. So, of course, no walls yet. You can see right through it into the next office, but it's very encouraging, and we are all very, very excited. And again, we very much appreciate the continued support of the board and of course, this committee. We went over to Widmer Interiors on Friday as well, Friday morning. And so this is how I have a really good indication that this is getting close to being completed, because Widmer Interiors, we were talking about furniture. We were talking about the nuts and bolts of the workings of the interior of that office. We were talking about desks and chairs and color combinations of things that I have absolutely no idea about. And so it's becoming very exciting. As far as a completion date, we're not sure, and this is the nature of construction. There are some optimistic folks who say that sometime in June it might be done. I believe that's overly optimistic. I think a better estimate would probably be towards the end of July at this point. However, there are some folks who are saying June, so we'll keep our fingers crossed. Last thing I did want to mention, I wanted to recognize someone from our office who will be leaving at the end of April. And as one of our attorneys, she's a contract attorney by the name of Stephanie Wisner. She has done a wonderful job over the past numbers of years, and she is one of the contract attorneys in the juvenile abuse and neglect and the juvenile delinquency courtrooms. I was speaking with both the judges up in those courtrooms, Judge Gillis and Judge Asbury, yesterday, and both of them spoke so highly of her. They have nothing but great praise for her, and told me how much that they are going to miss her. And I share that sentiment. We really, over the years, have greatly valued her service to our office and to the county of Peoria. She's done a great job, so she will be missed. And of course, we're working on contingency plans right now to fill her position. So really, that's the extent of my update, so thank you.
That was a great update. Thank you. Hope you're getting settled in the time being. How long has she served in that role, or as on contract?
She, Stephanie has been, if memory serves correctly, on and off. She took a brief break for maybe a year or so from the public defender's office, but I want to say at least 10 years she's been in some capacity with our office, and again has done just a tremendous job, and we are just so proud of her, and we wish her the best of luck in the future. I understand she's moving out of town, in fact out of state. She and her family, her husband and children, are relocating to a different state.
And I assume you're always in need of those interested in coming on contract?
Oh, absolutely. We're always interested in folks who are interested in doing work with us. So.
Thank you. Any questions? All right. Thank you. Now we'll move on to our resolutions. Can I get a motion to make a change to Chapter 5 of our Peoria County Code of Ordinances? Brian and Phil, thank you. All right. Oh, you're already up there. Thank you.
All right, thank you. So I want to talk today about trap, neuter, vaccinate, return, because that's the amendment you have before you. Unfortunately, in 2022, 56% of the cats either were euthanized or passed away in the shelter. And we know that other communities are solving the euthanasia problem in shelters with trap, neuter, vaccinate, return. And so we would like to change the ordinance to allow for that. Trap, neuter, vaccinate, return allows for, of course, cats not then to populate. What this would look like in the shelter is animals that are coming in from appropriate areas that qualify for the program based on their health, their age, all of those criteria, would be neutered, vaccinated, and returned to where they were picked up. And the logic is that these were probably not adoptable cats in the beginning. Cats in the shelter, when put into a small kennel, are often aggressive, or they get illnesses, or things that disqualify them for adoption. And so in doing this, we would be able to lower our euthanasia rate. Also, trap, neuter, vaccinate, return makes cats better neighbors in the community, reducing the hormones that cause yowling and spraying and fighting with other cats and all of those behaviors in the community. We hope that that will be a good outcome as well. And then lastly, trap, neuter, vaccinate, return, but with the addition of vaccines, improves the health of the population in the community. So we're excited for that. Back in 2003, the state of Illinois amended the Illinois Animal Control Act to define feral cats. And the language that I have before you is really mirrored on that state language from the Illinois Animal Control Act to be able to allow trap, neuter, vaccinate, return. The other thing that this change does is it will do away with the current barn cat caretaker program. As a kind of a toe in the water on this, many years ago we came up with a barn cat caretaker program. Under that program, you have to have a barn cat license with PCAPs. You have to live in an area that's zoned agricultural and meet all the criteria. And for $10 a year, you can have a license, and then that allows you to circumvent the need for annual rabies vaccinations and to circumvent the need for keeping the cat on the property. And so that entire program would go away. We would no longer have to manage that. It's not a loss to revenue to PCAPs. Quite honestly, I'm not sure that we were even covering our cost on that with the $10 application fee and the $10 renewal every year. So that there's not a lot of loss of revenue. The trap, neuter, return, the neutering portion of that is already accounted for in the work that we're going to do with Dr. Brown as a part of that contract. So there'll be no added cost there. Those animals will be incorporated into that program. So I'm happy to answer any questions that you have about the program.
I will share with anyone who's not familiar, like I was not. They aren't just setting traps out and randomly checking them. These are based on calls that come in. Then it will humanely trap and take care of. And they aren't releasing them into the wild. I think that was my other question. I thought you just let them go. They take them back to the area that was previously their domain. So any questions, Eden?
Thank you for letting me sit in on your committee. I just have some comments in support of this initiative. I have worked with cat rescues for over 20 years. TNR campaigns in my old hometown of Madison, Wisconsin have been around for even longer than that, and they are incredibly successful. As Becky said, you have a healthier feral cat population. They're far less likely to fight, and more importantly, they don't reproduce, and so eventually those decline. You cannot adopt your way out of stray cat overpopulation. You can't even trap and kill your way out of a stray cat overpopulation. This is the most effective way of making feral and stray cats good neighbors.
Thank you. Rob, did you have a question?
A few years ago, we discussed doing a feral cat program, I think trying it out in the Heights. How is this different than that?
I believe that was a little bit more managed of a program. That included, I think, colony cat caretakers, where someone was accountable and responsible for feeding and caring for those animals. Trap, neuter, vaccinate, return is really putting the cats back where they came from. So if a cat came from a particular area, we're going to neuter it, vaccinate it, microchip it, and return it where it came from, provided that it's healthy. And the logic is that that cat had a food source, that cat had a source of shelter because it was healthy when it was picked up from that area. And so it's really just about putting them back where they came from. If there's some concern about it being somebody's lost cat, the research is showing that cats are a lot more likely to walk home on their own, or for people to find them looking in their neighborhood than they are to go home from a shelter. We're only returning about 3 to 5% of the cats that come in to their owners, and many, many more of them get home just out in the community.
So we won't be providing those. There's like a starter kit, I think, in the feral cat program, and then I think in that program they were going to notch the ear so that the animal control officers could visually know that cat's already been taken care of. Is that gonna?
Yes, that is best practice in trap, neuter, vaccinate, return, is to notch the ear. And it's just taking a little bit off the top of the ear while they're under anesthesia for the surgical procedure anyway, to be able to tell it, as you said, at a glance that the animal is spayed or neutered.
Thank you.
Yes, Steve.
Just on the barn cat, how many people did we have that took advantage of that program?
We had about 75 people in that program.
Okay, because I could see there's probably a value to people that are in that program for their purpose. So that program will discontinue for those people, correct?
Right, and the discontinuing is really just the management of it. Of course, folks would, under these changes, be able to still have those cats. They just wouldn't have to pay a license and have to be managed, the program itself.
Yes, Sharon.
So Becky, you and I have talked in the past about a couple of properties that I've dealt with where there's been a cat problem. So how is that going to be addressed?
Yes, this ordinance would allow us to trap, neuter, vaccinate, and return those cats to that problem, to that property, and then thereby dissolve the population over the years. We also have some deterrence, which is what we've offered to the complainant for that property, that allow different types of deterrence. Let's say we have ultrasonic devices and we have little rubber spikes that you bury under your gardening material, and different avenues that we can work. If there are people in the community that don't want the cats around, we can help deter them from their property, and we've managed that with that as well.
Going down the line here, Paul, do you have a question? Okay, seeing no other questions, we can move for a vote. I think the important thing to consider is that this isn't taking anyone's cat. This is when there is a problem cat, trying to help address that issue. So if there's no other questions, all in favor? Opposed? All right, ayes have it. We'll move on to our Best Friends Animal Society grant. Oh, I need a motion, I'm sorry. Trying to rush through for everybody. Brandy, second. Sharon, thank you.
All right, so this grant before you is a $50,000 award that I solicited for the mobile spay neuter unit.
Any questions about this grant? We've talked a lot about the mobile spay neuter unit, so we're excited to keep things moving. All right, all in favor? Aye. Opposed? All right, can I get a motion for the final grant here? The Walmart Community Grant Teams Grant Award. Brandy and Nate, thank you.
All right, and this one, the local Walmart stores and Sam's Club stores, they allow you to solicit them once a year to several of their stores. So I did solicit them as well, specifically for supplies associated with the mobile unit. So there will be consumable medications and supplies that we'll need to stock that unit in order to keep this program going. They chose to award us $250 for that.
Questions? All right, all in favor?
Aye.
Opposed? All right, ayes have it. Thank you so much for all your work, Becky, in soliciting these grants.
bet.
Any public comment? Miscellaneous? All right. Motion to adjourn? All right, we're adjourned.